So I will probably take a quick, because I'm going to talk about the two recent studies carried in my study in collaboration with Dr. Tom McFadden in Missouri. With this audience, I will give very quick background. Okay. Firstly, I want to emphasize, as Ross pointed out yesterday, cow have 4 udders. Those 4 udders are very separated physically. Okay. So the left and the right are separated by median ligament. The front and the back are separated by membrane. So if you inject dye into one quarter, that dye does not go to another quarter without going through the systemic circle. So advantage for that is you can use each udder as an individual experiment unit. So that's called unilateral design. So that will reduce any more individual difference, but there is some drawback. There is some that may be diffused into the other side from systemic circle. So those are disadvantage, but we will see the unilateral still is a very good model. And I do not need to say how the mastitis affected the dairy industry, but I want to emphasize this study from a Canadian group. So it showed that, so in clinical mastitis, reduced milk production contribute 34% of the cost. However, in the subclinic mastitis, which is about half of cases in this study at least, so 72% of cost was due to reduced milk production. So my point is, reduced milk production is the major cost to the farmer. Pamela already told very well. So mastitis basically is the only caused by inflammation invaded by bacteria, include both gram-positive and negative. Gram-positive mainly include Staph aureus, and with characteristic soil wall component, LTA, Olga said it yesterday, so I don't need to say much. But for the gram-negative bacteria, so the cell wall main structure is LPS, which is major virulence factor. So a lot of study instead to infuse bacteria, so it's just infuse LTA or LPS. So in our study, we use LPS too. So also I want to point out, it's very clear, the bacterial invasion to bacteria cause both local and systemic effect. Local effect, particularly in clinic mastitis, include broken tight junction and the lymphocyte infiltration, high SSC, and maybe apoptosis of memory epithelial cell, which may cause permanent or temporary damage to the mammary gland. That's local effect. Systemic effect, for example, fever, right? And anorexia, and the production acute phase protein, leukocytosis, and even worse is the shock. Those are the systemic effect we know during the mastitis. However, so the question are, how about when the other infection, whether or not that, how much that will affect the neighbor mammary gland? So that's not very clear, okay? To what extent? So when other infection contribute to the other milk production, so we are not very clear. And the most important, what are those middle agents for systemic, for local effect? So that's not clear too, okay? So to answer those questions, we carry out 2 animal studies recently, okay? Started with mice. We use mice. We actually did 2 experiments. So simple design, use unilateral. So we injected one side first gland with LPS, another gland with the PBS. So unilateral gland, okay, design. So then we took the mammary tissue at 12-hour or 24-hour. So we did gene expression, cytokine analysis, and the oxidative stress or antioxidation study. We also took blood before or after the LPS treatment. So the cytokine analysis, we did an array which contained 32 cytokines. So we did quite a bit of cytokine analysis in the same experiment, okay? So let's talk about the data for this one. So unfortunately, we couldn't measure the milk yield in mice, but we could measure the milk protein synthesis. So we studied the several major milk protein expression, mRNA level, protein level. This one showed alpha lactalbumin. As you can see, at the both time, LPS significantly repressed alpha lactalbumin expression at both protein level, mRNA level. We all know lactalbumin is a major milk protein. Also, it's an enzyme for lactosynthesis. So that means this may affect the lactosynthesis too. Later, I will show you some data. Beta-casein is another major milk protein. Similarly, both the mRNA level, the protein level was super inhibited by the LPS at the both time, okay? However, for alpha S1, which is another major milk protein, so actually the mRNA expression actually even increased, okay, at 24 hours. Nevertheless, the protein levels, they are significantly inhibited. So that's the alpha S1. So it's not exactly same for those three major milk proteins. So we also checked the cleaved caspase level, which is indicated apoptosis. So we did see an early increase of cleaved caspase level, which indicated the cell apoptosis increase by the LPS challenge. So, but our major study is to find out why, what triggered those happen, okay? So we did RNA sequencing, just like everybody else. So we find roughly 900 differential expressed gene. We deliberately categorize those genes into 16 categories. So we basically use our own knowledge of each gene. So we group into each category. So as you can see, so the major group is immune related. So actually, majority of those genes are upregulated, so no surprise. So then we have increased apoptosis gene. We have oxidative stress, which is mainly the nitric oxide, oxidase-induced oxidative stress. And also, I'm going to show you the proteinase, proteasome actually significantly increased, okay? And then in metabolism, we do have up or down regulation. But in down regulated the category, we include mainly membrane vesicles. I'm going to talk a little about that. Membrane vesicle, milk protein, and also cell growth proliferation. Majority actually for that category increased. So, but we also did GOTEM analysis. GOTEM, everybody knows, David. GOTEM. So we list at least 20 up-regulated GOTEM and the 20 down-regulated GOTEM. Okay, from those genes up-regulated. So as you can see, very impressively, you can see the majority, the top of up-regulated GOTEM are protein zone, endopeptidase or protein zone. So that's very impressive, okay? And also, we do also see a lot of like cytokine signaling and chemotaxis, lymphocyte migration, etc. So in that category, mainly is the protein zone and the lymphocyte infiltration and the cytokine signaling, okay? So in the top down-regulated GO10, as I already mentioned, is mainly the coded vesicle membrane code, the vesicle transporter. You can see the coded vesicle. So you can see the major down-regulated probably is involved in circulation of mucosal component, because we know, like beta casein, a lot of those vesicles are packed by Golgi, so then released. So those probably related to that. Okay. Also, we see some metabolism, small molecule like amino acid, like organic acid. Those metabolites also down-regulated. And also we did a KIG pathway analysis. So the top again is proteasome, and followed by a lot of like cytokine signaling. Okay. So that's a KIG pathway. And this one showed the proteasome. There are two proteasome. One is standard proteasome, another one is immunoproteasome. As you can see, particularly in immunoproteasome, almost all those subunits are upregulated. But in standard, majority of those green one are upregulated, blue one not changing. But majority you can see they are upregulated, indicate proteasome play a very important role in the inflammation. Okay, probably by degrading invading bacteria. We also measure the oxidative stress and antioxidant items. We see there are significant decrease the catalase and superoxide dismutase. So in both in memory tissue and also SOD in the plasma. So indicated the decrease of antioxidation in those animals. However, we did see a decrease of hydrogen peroxide in both tissue and blood. But we did another experiment to show the increase at the early time, followed by decrease at the later time. Probably depends when you take the sample. Here we took a 12 hour. And for 32 cytokine analysis, so this showed that the cytokine increased in the both plasma and the memory tissue, include interleukin 5, 6, IP10, MCP1, MIP2, and the TNF-alpha. So those happen increase in the both plasma and memory tissue, indicating memory gland may contribute at least part of those systemic increase of those cytokines. However, majority of cytokine only increased in the blood, not in memory tissue. You can see many of those, okay? I'm not going to bore you to read each of those, but I can see a few, like colon stimulated factor, IL-1, IL-17, and the MIG and Rentas. So those are only increased systemically. And also interestingly, several cytokines, they have opposite changes in memory tissue and the blood. For example, interleukin gamma, IL-2, IL-10, IL-12, they all decrease in the memory gland tissue, but they increase in the blood. So we think those are the anti-inflammatory cytokine. So the decrease in the memory gland locally may promote inflammation. However, the increase in systemic, maybe they can protect non-infected tissue or something. That's just hypothesis. And supporting by that, you can see IL-4 also decrease in the memory gland by LPS significantly. That is, we know is anti-inflammatory cytokine. IL-9 is the only one decrease in the blood. IL-1 is the only one decrease in the blood, okay? So in summary for this part, we see LPS treatment significantly impress the milk protein expression and the induced cell apoptosis, okay? And we find from the RNA sequencing, in addition to strong pro-inflammatory response, we also see a very strong activation proteasome and nitrite oxide mediated oxidase stress. In the 32 cytokine analysis, 24 of them increased in the blood, included some of those major ones, okay? Like TNF alpha, like LR6. But in the mammary gland, locally, we do have several, they increased and several, they decreased. The increased one included LR5, LR6, IP10, LEAF, MCP1, MIP2, and TNF alpha. However, interleukin gamma, IL2, IL4, IL10, IL12 decrease in the mammary gland, okay? So that's the mouse study. But next, I cannot just talk about mouse study. We did the cow study here. So the cow study is more, little bit different. We combined both a local study. So just like we did in the mouse, however, we paired 10 cows into 5 groups, treatment group and the control group. So we have to know the design very clearly, so then not confuse the later. So in treatment groups, we inject LPS into one side, then saline in the another side. So this is called TL, this is called TS. We injected both sides. Later, I want to tell you is we can use the real side for the biopsy, then front side to take a milk sample. So that will not affect the sample. And also in the control group, so we inject the saline, then we inject NAN to this side. So the advantage for this model is we can compare LPS injected one to TS, which is the local effect. However, we can compare TS to CS. That will indicate a systemic effect. So that's a very unique design for this experiment. So again, we took tissue sample by biopsy in the real quarters at 0 hour, 3 hour, and 12 hour. Then we took a milk sample from front quarter at 0, 3, 6, 12, 24 hour. And also we took a bulk milk at 0, 12, 24. Field milk means you just use a castellator, you take from the neat. This is taken by the machine at the regular milking time, okay? We also took the blood sample at those time point. So next, let's talk about the data. So we see a clear systemic response as shown by body temperature jump after LPS treatment, but that come down within the 24 hour. Actually, it become even lower in LPS animal. And also in blood glucose level, you can see a dip of glucose level, then followed by recovery. So those show the clear systemic response in those cows, but we also see clearly local response. So you can see this is a TL, that's the LPS treated gland, which is the only gland with the high SC, somatic cell count. So only happen in this quarter, not in all other 3 quarters, include saline treated gland in the same animal. And milk lactate too, that showed clearly local response. So consistently, we see have a quickly lymphocyte, neutrophil mainly, infiltration to the mammary gland. And impressively, for the milk yield, as you can see, it shows clearly the local systemic effect. Systemic, as you can see. So the TL gland and the saline gland, for that treatment animal, they go hand by hand. So you can see, you do not see difference between those 2 groups. So those show significantly reduction compared to the control cows. So there is no local effect. Even we see it by compare TL versus TS. So that's decrease the same degree that at the 24-hour. We agreed we didn't do further. So to see when it recovered. So same thing for the lactose percentage, that just follow like a milk yield. We did also measure the protein level and the fat content. Okay, so you can see a local response for the milk protein. You can see in other 3 glands, you can see a deep, normally, milk and protein percentage. However, that was not seen much in the TL gland. So you can see a local response to the milk protein. But for the fat content, you can see a systemic response during this first 12 hours. So you can see there is a jump of lipid content, but however, not much seen in the control animal. So you can see the different systemic effect and the local effect to different milk components we see, okay? And we did see increase, a very brief increase, caspase, which indicated apoptosis again. But again, that only happened very shortly, okay? Nevertheless, we didn't see the changes in mean alveolar area and the mammary epithelial cell number per alveolus. So we didn't see the changes, at least at the 12 hour. Okay, we cannot guarantee after that. So then we also did the RNA sequencing to see what's going on in the mammary gland, in both locally and systemically. So we did a little bit different. This time we didn't do the tissue. We did a mammary epithelial cell. We isolated mammary epithelial cell from those quarters by laser capture micro dissection. Then we did the RNA sequencing. So that represents only the mammary epithelial cell gene expression changes. Then again, we compare these 2 glands for local changes. Then we compare TS versus CS for systemic changes of gene expression. So at 3 hours, we see about 956 differential expressed gene locally, okay? So we did the GO10 analysis and the kick pathway analysis. As you can see, the major GO10 changes induced by LPS treatment is cytokine signaling, cytokine inflation, chemotaxis, apoptosis, and this is RNA is translation. Then interested in the insulin resistant pathway. So we talked quite a bit yesterday, okay? And supported also by KIK is mainly cytokine signaling, even with potentially insulin signaling and GJAK and STAT signaling. So those local changes at 3 hours. Down, we also see 568 down-regulated gene expression at 3 hours locally. So the major down-regulated one, oh, I forgot to mention, you didn't see proteinase activation in the mouse study. That was really interesting. It's either to be species difference or it happened between tissue or cell. This time we did a cell again, the mammary epithelial cell. Another experiment was in tissue. So, so in down-regulated gene, GO10 is a metabolic pathway mainly. I think Teresa like to see this, right? Circadian entrainment. Maybe we can dig in together to see what this means. And also oxytocin signaling pathway. So oxytocin, we know it triggers the myoepithelial cell contraction. But what oxytocin signaling happen in the mammary epithelial cell, that's also interesting too. And the tight junction protein decrease too, okay? So KIK also shows some effect of those oxytocin signaling too, okay? So systemically, the change I just said is locally. Systemically means again, it happened for this gland, saline treated and the saline treated. So systemic, we did see 35 upregulated gene, 25 downregulated gene. For 35 upregulated gene, it's mainly again the cytokine signaling, cytokine, okay, and maybe also adhesion molecule, and then non-Goten analysis for 21 DG, okay. So for how about the 12-hour? So the gene expression, differentiated gene at the 12-hour significantly reduced, only like 400, okay? But again, the main cytokine signaling, host class differentiation, cytokine. So you can see the majority. There is one, HIF1 is a hypoxia. Potentially there is hypoxia at that time, okay? There's some metabolism decreased down go to 12 hours. So this now for the 12-hour, the systemic, we saw 21 DG upregulated and the 32 DG downregulated. But this time we did not see immune pathway, actually. So there's some metabolic pathway was upregulated with some decreased, okay, that's 12 hours. So for the cytokine, we used the array again. So this array contains 15 cytokine. That's the biggest cytokine array we could find commercially. So this one, 15. So we did also measure those cytokine changes. So all those cytokine analyzed except 3, they're all changed in the mammary gland locally. Specifically, you can see here. So like TNA alpha, IL-1A, L1B, L1A, those have a spike at 3 hours, then return to normal by 12 hours, you can see. So they have a very quick response. And however, like IL-36RA, MIP1A, MYP1B, MCP1, and IL-8, those has a sustained effect, at least up to 12 hours. They have a later response, but a lasting longer response, okay? So those are the locally in the mammary gland. So there's few decreased, again, in the mammary gland. So sorry, so you should see, because we're talking about locally, is the red line versus the green line. Red line means TL, LPS treated group, okay? So you can see interleukin gamma, IL-4, IL-2, those are the anti-inflammatory, so the significant decrease locally in the mammary gland. So again, those are anti-inflammatory, so that may be promote the inflation. Systemically, in the mammary gland, systemic, that's a comparison of TS versus CS, okay? You can see again, the majority of, now this time compare the green versus the dark. So you can see those one decreased in the mammary gland we just saw, actually they increased in the CS, increase in the TS versus the CS. That means in the non-LPS challenge gland, the increase compared to the normal cow. So that means they protect those non-LPS challenge glands systemically, potentially, okay? So as you can see, they clearly have an increase systemically, okay? So also include MCP1, MIPB, and VGF-A. So those are increased in the systemic gland. In the blood, you can see the major cytokine increased in the treatment cow versus the control cow. TNA alpha, LL6, IL-10, IP10, MCP1, M1B, and the only one is NF gamma decreased, actually in the treatment cows. Okay, so in summary, for the cow study, we see clearly systemic effect and the local effect in our model. So which showed very clearly for different things we measured, okay? And the gene expression changes, which mainly happen locally in the mammary gland treatment, mammary gland LPS treated 95 DG happen at the local expression. That mainly included cytokine, inflammation, apoptosis, and the cell signaling and metabolism. But systemically, in the mammary gland, the gene expression is mainly inflammation or cytokine signaling, and with the decreased lipid metabolism. All those changes are very time dependent, okay? It's transient. For the cytokine, so we do find a group of cytokines, they increased systemically in the blood, but also we find a group, the one systemically increased the mammary gland tissue or decreased in the mammary tissue. So those are the cytokine list. So I'm not going to repeat it. So in summary, from our two studies, so our study show clearly effect of at least LPS challenge of mammary gland cause local effect and systemic effect. Particularly, we are very impressed the systemic effect on the milk production in non-LPS challenged quarter, those 3 quarters without LPS challenge in the treatment cows, because those TSTL gland, the milk production were very similar for the at least 24 hours, okay? By the RNA sequence analysis, we saw the major changes seems related to the cytokine signaling. So include both local effect worse than systemic effect. We didn't see a lot of other things going on, particularly it's only cytokine signaling. Remember, this is mammary epithelial cell, so we didn't really see a lot of other things, okay? But we also identified some potential important cytokine may play important role in this systemic effect or local effect, such as interleukin gamma, IL-4, MCP1, TNF alpha, very important for local, IL-6, IL-10, MCP1, MIP1B, and the TNF alpha appear very important local effect. So back to our purpose, we want to identify the mediator responsible for systemic effect, local effect. So what do we come out? Did we find them? No, not yet. But that provide a good candidate for us to do the further experiment. So currently, we are treating the cell with different cytokine or with a combination cytokine to see the effect on the milk synthesis. So hopefully we can also do the animal study just to interfere those different signaling to see what happened in the LPS or mastitis cows. Okay, thank you for your attention. So I do have a few minutes probably for questions.